If you care for, teach, or support someone with ADHD, well, you already know the daily reality can be both beautiful and incredibly challenging. Welcome to this explainer brought to you by our clinic. We're going to dive deep into the modern neurobiological understanding of ADHD to really equip you, parents, teachers, and caregivers with real, actionable solutions. Today, we are pulling back the curtain on the actual brain mechanics behind the behavior.
So here's a question we hear in the clinic almost every single day. If they can focus on video games for literally hours, why on earth can't they focus in class, right? It's the ultimate frustration. But honestly, understanding this exact paradox is the master key to unlocking how the ADHD brain actually works. We tend to think of attention as this simple all-or-nothing switch. But in reality, people with ADHD possess an amazing capacity for hyperfocus, but only when the conditions are exactly right.
There's this brilliant quote from a student that just perfectly captures this reality. They said, "My mind's a great sprinter, but it's a lousy distance runner." That hits the nail on the head, doesn't it? ADHD is absolutely not a willpower issue. It is a complex executive management issue. A student might completely crush a high-intensity, deeply engaging task, like playing a fast-paced sport or building a massive Lego set. But ask them to run the marathon of a long-term multi-step project. That's when their attention falters.
Okay, so here's our roadmap for today. We're going to cover the ADHD focus paradox, look at signs beyond the surface, take a trip inside the ADHD brain, talk about the power of early support, and finally wrap up with some real tools for better focus. We're dismantling the myths and getting straight to the science.
All right, part one, the ADHD focus paradox. We really need to rethink this whole behavior problem label. For decades, basically from 1902 all the way up to 1980, our understanding of ADHD was just fundamentally flawed. It was slapped with a label of a behavior problem. The classic, outdated stereotype of little boys who just couldn't sit still. But modern science tells a completely different story. It's an executive function issue. The brain's manager, the part that organizes, prioritizes, and sustains effort for tasks that frankly aren't all that thrilling, is just really struggling to do its job. Moving on to part two, signs beyond the surface and the hidden struggles. What's really fascinating here is that the most disruptive signs of ADHD are often totally invisible. We're talking about a prevalence of roughly 1 in 10 children. With those numbers, it is absolutely crucial that we look past just mere hyperactivity and recognize the much broader, quieter symptoms. Not every kid with ADHD is bouncing off the walls. Actually, many are sitting quietly at their desks, staring out the window, totally lost in thought, or silently struggling to organize the massive influx of sensory data all around them. Caregivers, tell me if this sounds familiar. The infamous pile system for organizing a messy room, or maybe intense emotional flooding over what seems like a tiny annoyance. These are core hidden symptoms. People with ADHD often struggle with time blindness, meaning they'll constantly underestimate how long something takes unless there's an absolute panic-inducing deadline right in front of them. Their physical pile system makes perfect sense to them and to literally nobody else. And emotionally, a tiny frustration, like someone chewing too loudly, can literally feel like a massive computer virus crashing their brain's processing power. And a big part of this comes down to working memory. That's the brain's short-term ability to hold and recycle information for immediate use. Now, an individual's long-term memory might be absolutely amazing. They might vividly remember every single play of a sports game from 5 years ago. But if you give them a 7-digit phone number and ask them to walk into the next room to write it down, poof, that information just vanishes. The brain's short-term recycling system just drops the data. Okay, section 3, inside the ADHD brain. Let's talk about the conductor and the networks and see what's physically happening under the hood. In a typical brain, you've got the resting network, or default mode network, and the task network, and they act just like a seesaw. When you focus on a task, the resting network turns off. Makes sense, right? But in the ADHD brain, they mistakenly fire at the exact same time. It causes all this mental static and severe distraction. Imagine a band where the drummer and the guitarist are completely out of sync, just playing loudly over each other. Instead of a smooth shift between resting and focusing, the ADHD brain tries to do both at once. No wonder concentrating is so exhausting. So what's the missing piece here? It's dopamine. Dopamine is the chemical conductor of this neural symphony. It regulates focus, motivation, and the switching of those networks we just talked about. But in the ADHD brain, this conductor isn't releasing signals effectively. It's kind of like a faulty spark plug. Normally, dopamine efficiently jumps across the tiny gaps between neurons to carry messages. But here, these microdots of dopamine either aren't released enough or they just aren't reloading properly. And without a strong conductor, the networks just fire randomly. This faulty circuitry leads to something called attentional blinks. This means people with ADHD don't just lack focus. Sometimes they overfocus on the wrong things and literally miss other vital information flying by. Think of it like rapidly scanning a crowd looking for a specific face. The second you spot it, your brain celebrates and blinks, making you completely blind to the person standing right next to them. People with ADHD experience these attentional blinks at a way higher rate. Their attention shuts off for just a fraction of a second, causing them to miss crucial pieces of the puzzle. Which brings us to Section 4, the power of early support and leveraging neuroplasticity. Understanding this biology naturally leads us to why proactive intervention is so incredibly vital for kids, and honestly, why we emphasize it so heavily at our clinic. It's all about neuroplasticity, the brain's capacity to rewire and reshape itself in response to experience, and it is at its absolute peak from ages 3 to 13. During this window, the brain is essentially like wet clay. It's highly moldable. When we introduce the right tools, scaffolding, and sometimes medication during this specific time, we aren't just slapping a Band-Aid on a problem. We are physically helping the brain wire its executive function networks correctly before that clay hardens in adulthood. And speaking of medication, there's this powerful quote from Dr. Thomas Brown I always come back to. The medicines we have for ADHD cure nothing. It's more like my eyeglasses. Prescription stimulants work by increasing the availability of dopamine. Just like putting on a pair of prescription glasses instantly brings a blurry world into sharp focus, the right dosage of medication helps the brain's conductor manage the signals. But just like glasses, the moment you take them off, the blurriness comes right back. All right, final section, tools for better focus. Let's look at a multifaceted approach, because medication is definitely just one piece of the puzzle. Diet actually plays a massive role here. Kids with ADHD naturally crave sugary foods because sugar causes a quick dopamine spike. But as we know, that just leads to wild hyperactivity. Eliminating those simple sugars can have a dramatic positive effect. Meanwhile, high-quality omega-3 EPA supplements act as a really powerful modulator to support overall brain chemistry. You have to think of diet and sleep not as a cure, but as the ultimate baseline supports that dictate how well the brain can actually use the dopamine it has. So true support involves 4 key steps that we always champion at the clinic. First, seek a professional clinical evaluation to identify specific deficits. Start with a proper diagnosis, not a guess. Second, build organizational scaffolding right around the individual to help them manage their space and time. Third, clean up the diet to eliminate those high sugars. And fourth, practice open gaze or interoception. Simple things like sitting quietly for 15 minutes to focus on breathing can actually physically train the brain to maintain an open gaze and drastically reduce those frustrating attentional blinks over time. Supporting a neurodivergent mind is never about changing who they are. It's about giving them the precise eyeglasses they need to see their own potential clearly. Thank you so much for joining us for this explainer. I want to leave you with this final thought. Since ADHD has absolutely nothing to do with intelligence, imagine what these amazing minds can achieve when we finally give them the right tools.